Some more news on the Facebook data scandal today, in fact, just this afternoon. CNBC.com's Christina Farr has a scoop reporting that Facebook was planning on partnering with hospitals to collect health data. The plan has now been put on hiatus in light of their privacy issues. This news comes on the heels of COO Sheryl Sandberg saying that a few hundred advertisers have paused their spending on the platform as they wait for the company to answer more questions on privacy. The shares still closed up a little under 3%. Christina joins us now for more on what exactly was going on here. Christina, I encourage everybody to read the piece. There's a lot of good stuff in there and a lot to understand about how much access Facebook does have to your information, because they were basically, for research purposes, going to offer hospitals the ability to match kind of their patient records against Facebook profiles. Is that right?
Yeah, it's kind of terrifying stuff, sort of bordering on creepy, but it could have been interesting had they gone about it the right way. So the idea was basically that Facebook would partner up with top hospitals across the country, and they would see whether they could combine their data sets, which would be kind of your community, who you interact with the stuff that the hospital knows about you, so more your medical condition, what medications you take, and so on. And the idea would be that this data set could be used for research purposes, at least initially. That's what Facebook has reassured us. But who knows? You know, if this had been allowed to go ahead, we don't know how ambitious it would have gotten.
Yeah, and I can understand in a sense where it's coming from, and kind of you get a glimpse of maybe where society is headed. The idea is, okay, somebody shows up at a hospital and they suffer a heart attack. You might have their height, weight, a few basic details, but if you could match that with their Facebook profile, you'd have a lot more about their lifestyle, possible triggers. You know, it may be something that's meant to help address the patient, but something that does require learning a little bit more about them.
Yeah, that's right, Kelly. And this could have been used in a good way. And you could imagine, say, an individual with heart disease just leaving the hospital. Maybe they don't have the right support system around them to ensure that they can stay healthy. And perhaps a nurse could have been sent to their home if Facebook and this hospital partner had known about it. But this project is not going to happen as far as we can tell. It's on pause until Facebook can really clean up a lot of the data privacy issues that it's facing now in the wake of that massive Cambridge Analytica data leak. So we'll see if it continues. Who knows?
Yeah, I was just going to say, Christina, I wonder, if Facebook were to be transparent about it and say, okay, yes, we're going to put this out there, and we're going to give you, the user, the opportunity to say, do I want to share this information with my, local health officials or not? I mean, maybe some people would opt in.
That's absolutely the key. And I think the right word that we should be thinking about here is consent. So we don't know, because none of the data agreements were signed with these hospitals, whether or not there would have been some consent. We don't know whether Facebook would have said, do you want to participate in a research study like this? And my sources are telling me that that wasn't really discussed. It was still too early. So this was ongoing for a year. No one knew about it. And today we've learned that it would have happened, perhaps even in the next few months, had this data breach not occurred and put Facebook on other priorities.
The other thing, Christina, is that Mark Zuckerberg has taken pains to draw the distinction between saying to people, we aren't selling your individual, you, Kelly Evans, to advertisers. We're bundling this all together and splicing it up to say, hey, if you want a 30 to 35-year-old woman who loves the show Fixer Upper, this is your girl, or these types of people, fit the bill. Would the same thing happen with this health data? Because it sounds like it was going to end up becoming individualized, even if they used this hashing technique to match people.
Absolutely, that could have happened down the road. And Facebook made very clear with me when I spoke to the company that they wanted this data to be anonymized, so they wouldn't have known necessarily that it's Kelly that they were looking at. There would have been a code instead. But there needed to be a way for them to match your data as an individual to the health system's data, so they know that they're talking about the same individual. So while Facebook has said, we wouldn't know things about you necessarily, we want to make sure that this would be anonymized. We don't really know if it would have been truly anonymous kind of going forward. And there are definitely some questions here as we, examine whether or not Facebook is going to continue to do more in the health sector,
right,
just like the rest of the Silicon Valley ecosystem.
Well, and that's exactly it. So if this is on hold from Facebook, I can think of a few other companies, Amazon, who know a little bit more about me, and they might be going through, and thinking the same thing about what you future the health business and how they can help or contribute.
That's a great point. We're seeing Amazon, we're seeing Alphabet, and now even Facebook. Think about the health sector. It's an opportunity that they just can't ignore. Think about how much these tech companies know about us, and this type of data is very attractive and perhaps even lucrative for healthcare companies, whether it's your hospital, clinic, and so on, even your insurance company. So we're going to have to kind of see how that goes, and certainly we'll be tracking at CNBC.com how these companies plan to use your data.
Yeah, no, it's all the more reason to know exactly how it's being used. Great stuff. Christina, thank you very much for joining us.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.